Our next hormone we'll talk about is growth hormone, and another name for growth hormone is somatotropin. The root word of this, somato, refers to body, and growth oftentimes is associated with tropin, growth or some sort of a change. So growth hormone is going to bring about changes in various tissues within the body. We're going to focus on a few of these. So let's look at how this hormone is initiated with regards to its secretion. So as we've seen before, we'll see a hormone released from the hypothalamus, and this is called growth hormone releasing hormone. It's carried through the hypothalamic pituitary portal system to the anterior pituitary, and there, wherever there are cells that have receptors for growth hormone releasing hormone, that will cause those cells to release growth hormone. Growth hormone then, as I mentioned, will focus on three different tissues, the first of which is it can go to the liver, and in the liver it stimulates the production of another substance called somatomedins. And there are various types of somatomedins, but the one that seems to be most significant and the one we'll focus on is called insulin-like growth factor 1, or IGF-1. Growth hormone also has direct actions on bone, and it will also have actions on muscle. So let's take each of these individually. So first we're going to see growth hormone go into the liver, and there will produce or result in the production of somatomedins. And again, we're going to focus on IGF-1, or insulin-like growth factor 1. So IGF-1 has various metabolic effects. Ones that we're going to focus on will be its relationship to the function of insulin, and it seems to be antagonistic with regards to its effects to insulin. So growth hormone will cause an increase in plasma glucose. Probably its most recognizable actions are those that it has with bones. So here we have growth hormone being released, and this is a picture showing the femur. So this is one of the long bones, and this is where growth hormone can demonstrate its actions. So let's review some normal anatomy of a bone and how it is created. So if we were to take a sample of this and stain it and look at it under a microscope, what we'd find is that at the end of these long bones, we have this area of cartilage. So this cartilage here, this is a specific type of cartilage. It's not the standard articular cartilage that many of you are used to or have knowledge of, that helps joints slide by each other as they function. This cartilage is within the bone itself. And this particular area of cartilage is referred to as the epiphyseal plate, also more commonly known as the growth plate. So this is the site where bones are going to be growing, and as this area grows, the bone is going to become longer. So let's zoom in and see what this particular area looks like. So what we're going to see is that here at this epiphyseal plate, and this is just one surface, there'll be the reverse of this going in the other direction, but what we see is we have these cells here, and these are chondrocytes. And chondrocytes are going to lay down an extracellular matrix that will create a specific type of cartilage. These chondrocytes then will, as they proliferate and they produce this matrix, they eventually will die. They will leave this cartilaginous framework behind, and then swarming up along this will be these little cells depicted here, and these are called osteoblasts. So these osteoblasts are going to come in, and they're going to transform this cartilage and change it into bone. So this is how we grow our bones, and this is how at the epiphyseal plate we see an increase in length. So this is where growth hormone has its major effect. Now if you've seen an x-ray before, this is an x-ray of a patient's knee. So this is the femur, or the thigh bone, and here's the tibia and fibula. So this is the lower leg bone. And notice this area here, which appears to be darker here. So the calcified bone has a very white appearance, and this black area here is the growth plate, or the epiphyseal plate. So this is where growth hormone is going to have its actions. So this growth plate, we say, remains open during childhood and adolescence. And then when puberty hits, androgens are going to cause this growth plate to fuse. And once that happens, the x-ray will change from this appearance to this appearance. So notice that this would be a x-ray of someone who is after puberty, an adult, and their growth plate has now fused. So these bones will no longer be able to increase in length. And then finally, we'll mention the effects of growth hormone on muscle. And growth hormone is an anabolic hormone, so it's going to promote muscle growth. Now, it's easiest for us at this time just to comment on the fact that it will cause an increase in muscle mass, but realize that growth hormone also has some more generalized anabolic function, promoting growth of various tissues. So now let's look and see what kind of clinical manifestations will occur with abnormalities with growth hormone. So first, let's look at an excess of growth hormone. This is a picture of an MRI, and this is what we call a sagittal view. So this is as though we've cut this patient's head, sliced it directly down the middle. So this would be the forehead here. This is the nose. This is the tongue. So this is the brain stem going down to the spinal cord. And what's being identified here is where the pituitary lives, and so this is representing a pituitary tumor. So this may be what a pituitary tumor looks like that might produce excess growth hormone. Now, the clinical manifestations of this will be dependent upon the timing that this excess is present. So if we have a growth hormone excess during childhood and adolescence, or what is sometimes referred to as simply prior to puberty, then what we're going to see is the condition of gigantism. So these are pictures of patients with growth hormone excess causing gigantism. So this is a famous picture. This patient has the gigantism. This is his father, and this is his younger brother. Here's a younger patient with the gigantism. This is his mother. You can see he's darkening the door of the entire door frame. He's so tall, and he's also large. And if we look in at his hands, this is his hand compared to the adult physician's hand, and we can see that growth hormone not only causes an increase in stature, the gigantism, it also causes increase in soft tissue, as demonstrated by these very large hands. Now, if we have growth hormone excess after puberty, so after the epiphyseal plates have closed, then the bones can no longer get longer, and this is going to result in a condition called acromegaly. So although the bones can't get longer, they still can become thicker. And so there's a very classic appearance of patients that have acromegaly. I've got a couple of old pictures here that kind of demonstrate through the years. So here's a man and a woman, kind of in their earlier ages where they appear to have fairly normal structures. But notice what happens as we continue to follow them out over time. And it's striking how even though we have a man and a woman, the facial features actually are quite similar. And this is a very classic appearance of a patient who has acromegaly as a result of a growth hormone excess. This picture also demonstrates her hands, which you can see have become quite thick and large. Here's a more recent color picture, and we can see, again, very typical and common appearing facial features. We see very thick, thickening of the brow. Realize that as the mandible or jawbone thickens, it also tends to become longer. And what we'll see is, if we look at these people's teeth, is that in a patient who has acromegaly, they may end up changing their bite. So normally, normal dentition, when we bite our teeth down, the upper teeth are going to be protruding over the bottom teeth. But with acromegaly, because of the changes that occur with the mandibular growth, we may actually see that reverse. And here's a picture of a couple of identical twins. And so we can see that this patient is the one that had the growth hormone excess. And although they both tend to have fairly square jaw appearances, we might see some characteristics of acromegaly in this face compared to this one. So this may have been a patient that had growth hormone excess during adolescence as well as during adulthood. This is a picture of his hand compared to his brother's hand. And then this is a typical appearance of someone's feet with acromegaly. We see the thickening of the bones here, as also the excess soft tissues. A classic story in older patients who would have acromegaly would be that you'd have an adult whose shoe size increases, as well as hat size increases because of the thickening of the bone in the skull. And then briefly, hormone deficiency. If we see hormone deficiency during childhood or adolescence, then these are children who are going to tend to have a shorter stature. They're going to have reduced muscle mass and tend to have reduced bone density, so their bones can become more fragile because of the effects of growth hormone. If we have a growth hormone deficiency during adulthood, we don't tend to see the obvious physical manifestations that are readily available during childhood. The typical adulthood symptoms of growth hormone deficiency are going to result more in common metabolic abnormalities.